I personally remember a lecture by Dr. Ramakant sir as an integrated lecture which sir had taken when anatomy, physiology, biochemistry and surgery and all were combined together. So sir had given a talk in NT5 wherein it was a deeply amazing lecture wherein he talked about his history as a GSI which we all fell in love with. So it would be very nice to hear him again. Welcome sir.
Talk for 2 minutes before you start. Can I talk for 2 minutes? I am sure Dr. Geeta will join me in what I am going to say. I want to thank Almighty because all of us are very disturbed, profoundly disturbed, when out of blue we were told Ravi is not there. Sorry to be just saying Ravi. And what you are seeing today is a miracle. I mean, it's really very heartwarming. So mentally I am going to pray that Almighty is. You must have seen here, even outside our MICU, we have put Manusha Yatna Ishwar Krupa. And what we are seeing today is Ishwar Krupa. So, thank you Almighty. And here is Ravi.
Okay, can you guys hear me at the back? Yes. At the back, great. First of all, thank you for coming in on a very special day here when you have your traditional dress photographed or something. I was thinking to myself, if I were in your position and somebody told me there's a lecture on medical philosophy, medical humanities, what would I be doing? I would not be in the campus, I'd be home. Yeah. So something is special about you guys that you turned up here to listen to me of all the animals in the zoo. I can't promise I'll make it interesting. I'll surely give you a slightly different perspective than what you are used to hearing about in medical school. And these series of lectures and activities have been arranged under the program of medical philosophy or medical humanities, and we should all be proud that ours is the only medical school in our country that has a special division. Yeah? And the hope of that, we are not going to teach you anything. No, we are not going to teach you this is how you should be, right? We are trying to convey our experiences of being a physician so that you may emulate what you want to. Yeah. So that's the general philosophy that we are having as how medicine was once upon a time, how it is, and if you want to change your practice of being a physician. Yeah. Underlying all that, underlying every one of these words is what I'm going to talk about today for about half an hour, 45 minutes max, and if you feel bored, you can happily get up and walk out. That's fine with me. Yeah, you don't have to sit through this, but you can surely go away if you feel this thing is very, very boring and not for your ears. So can we start with the first slide? Now, one of the things which I've learned over time, and something that you may not believe at all, is that so much of, can we have the lights down? Radiologists always work in darkness, right? So one of the things I've always learned from my own teachers and mentors is that it's so important to be able to look at history. Now I'll tell you a story. And the story was like this in my life, about 15 years back, and I'll tell you a lot of stories now. Yeah? It's going to get rambling, it's going to get half an hour, 45 minutes, it may get longer. You have to start looking at the calendar then at your watch. I don't know what is going to happen. Yeah, so I give the liberty for you to walk out. The story is like this. For our 75th anniversary, so that was 15 years back, Vinita Salvi. Now, Vinita Salvi was a professor of obstetrics and gynecology here, and I went to Shivri Christian Cemetery, yeah, which is right down the road. Because the architect of our institution, of our College, George Whitted, is buried there. Yeah? At the age of 45 or so, he contracted cholera and passed away and is buried there. And we had a time of our life, Muscovine, the curator, that is not the curator, whatever he is called, sitting with the register, to go through the records of 26 or whatever, and locate his grave. Can you believe that we actually located his grave? And had I thought of it, I would have even shown the photograph of that grave, that we got clean. In fact, Vinita did a lot of work, got it clean, restored, and we took a picture of that. The sense of history of a man who designed my college, and the Prince of Wales Museum, and the Gateway of India is an amazing feeling. Yeah? Gateway of India, Prince of Wales Museum, G.S.MEDICAL College. That is the history that we have. So this is a picture that you may have seen in anatomy. It's called Janus, the Greek god Janus, and it's believed that this god can look into the future as much as he or she can into the past. So when we sit today in modern medicine, that is going to be the thrust of my talk. How modern medicine fares in comparison with what medicine was maybe 100 years ago, maybe 1,000 years ago. Where have we come from? What are we doing right and what are we doing wrong? The sense of right and wrong is individualistic, right? I have no right to say what is right for you and what is wrong for you. You have to decide yourself. What we are trying to achieve in these lectures is to instill the concept of what is called as critical thinking. Yeah? It's not a phrase that you're familiar with. It's very, very a common phrase in the arts. Critical thinking. That means you don't take didactic lectures like this. You engage in a dialogue. Right? I say something, you question me, and then we have a dialogue, and then you come to what is right and what is wrong. So it's not a catchphrase, it's something very important. In medicine there is no critical thinking. There is garbage in and garbage out. Structure of a neuron, garbage in, structure of a neuron, garbage out. Right? There is hardly any scope for critical thinking, and that's a big danger. And that's what you are used to from standard 8, multiple choice questions. Right? Suppose I asked you what day of the week this is, today is, you may not know the answer. Suppose I told you today is Monday, Tuesday, Wednesday, Thursday, and you are told how to tick. Yeah? So tick where applicable is where you come from. Many of you have come from, it is not your fault. That's how our education system has become. So when you have a tick where applicable and purely science with no liberal arts background, yeah, how can you be a physician? Because so much of being a physician, by the way, the word physician does not mean an MD, and a surgeon does not mean MS. A physician is a person who heals. He can maybe an MD, an MS, an MBBS, it can be whatever. Physician is a person who heals. When you are a physician and dealing with real human beings, how can you be a person who has none of the skills that liberal arts brings with it? Yeah? How can you be a tick where applicable? How can you everything be black and white? There are so many grays in every human being. You are different from her and you are different from him. Every one of us is different and we are dealing with human beings. Yeah? So it's nice to know where we came from, the history of medicine as we go on to the next slide. Oh, I can do it myself. Doesn't seem to work. Yeah. So we have a tremendous tradition in our own culture of classical medicine. Yeah? This is a picture from maybe BC, 200 BC or so, Sushruta. They performed surgery. What's actually being done now is some form of plastic surgery. Yeah? And so we had the Egyptians doing it, we have the Indians doing it, and you will be shocked to see the Red Indians here doing refined. Yeah? I don't know what type of anesthesia this is called. It's not general anesthesia, it's not local anesthesia, it's not vocal anesthesia. It is, you better lie down or I'll give you anesthesia. Whatever you want to call that. Yeah? So, there's one type of surgery that was being done, and here is something from the Egyptian pyramids showing the type of instruments that they used to perform the various surgery. And this is a picture of what is available from our country, of the instruments that were used, and here are the various instruments that were used during plastic surgery and other surgery during Sushruta's time. So go back 2,000, 3,000 years back, and this is the type of expertise we had as far as various surgical procedures are concerned. Then you can guess the amount of understanding they must have had of medicine itself to be able to perform these kinds of surgeries. Why am I saying all this? I'm building the ground for why knowing history of medicine is sort of important. Yeah. As you grow older and older, when you finish your third MBBS, when you finish your PG entrance test, and you finish your MBBS, MD or MS or whatever, and you've made enough money in life, and you realize that this is all fruitless, completely waste of time. Yeah? What is essential is an intellectual satisfaction of where you come from. Yeah? That's what sets human beings apart from animals. I want you to look at what happened later on. So there was initial technology, and this is the beginning of real technology, the ancient stethoscope. And I said, what I'm trying to address here is what technology, essentially the underlying principle, the overarching principle of this talk, is what has technology done to modern medicine and how it has probably done good or bad for the care of the human being. Yeah? So this was an initial stethoscope about 150 years ago, and then we had my own grandfather, great-grandfather, William Brongen, who discovered X-rays, and this was his wife's hand X-ray, yeah, 1895, and then medicine changed. And then technology improved, we had functional MR, we could see actually which part of the brain lit up when some part of the hand or the leg or whatever was being used. So technology is immensely progressing, so you can see inside without having to open up outside. And this is the whole brain lighting up. Yeah, the whole brain lighting up in a female volunteer during an orgasm. Yeah. So when you say orgasmic, you can understand what happens to the brain during that time. And why it is so essential, because propagation of species is the prime importance of living. Yeah. An animal will kill, a male will kill another male of the same species only for sex and nothing else. Yeah. So propagation of species is such an important thing, and the whole brain virtually participates in this action. So modern technology has given us the power to look into the brain, to look into so many things, to be able to see that. And have we stopped there? No. We have gone on to PET scan to see metastasis all over the body. So when you get carried away, version Windows 95, Windows 2000, Windows 7, then Windows 8, and then Windows 10, you keep on losing perspective of where you are going, right? You just carried away by technology. WhatsApp, yeah, there was messaging and now we have WhatsApp. Just because there is WhatsApp, somebody sends me an X-ray which is of so poor quality that I cannot open up at all. You're just wasting time. So sometimes technology for the sake of technology is bad. I'm not saying all technology is bad. And in medicine, it has its downside, because when you have technology, you sit in the side room of a hospital ward, look at lab reports and treat the patient. Yeah? And it is already happening in the way. There are no ward rounds. After the first day, you see the patient. And there is a huge downside to it. Nobody is touching the patient. Yeah? Nobody is just touching the patient when it needs to be happening. Nobody is asking the patient to strip and examining the back and front, and you can read lots of these anecdotes and examples of what happens when you don't examine a patient and treat the patient just by lab reports. Yeah? And when you have so much technology and you're losing your way, this is what an unborn child tells you. Go have a walk. Yeah? What you are doing is you're losing your way. Yeah? Don't look at me like this. Why do you want to look at me like this? Whether you look at me like this or not, I'm going to come out and trouble you in your life. Yeah? So it's like showing one or two fingers. It's showing your tongue and saying that don't waste my time, don't waste your time imaging the unnecessary images. Yeah? So this is just a crude example of telling you how you can lose your way using technology, especially in your generation. When you have so much technology to use, you are likely to lose your way When you mistake technology and lab reports for the patient's problems. Yeah. So this I will now try to relate to what happens, to what you should be doing. What I hope you will be doing is to break patterns of what has been happening so far, the so-called progress of technology, and create change. And change is in your hands, literally in your hands. When a patient, imagine this situation, if you will, you can close your eyes. You have still not come to a stage when you are treating patients, but you can imagine a situation where you are sitting in the consulting room with a white coat on your hand, on yourself. There is a table there and there is a patient sitting on the other side. This is a very profound example of what I've heard told by a great medical philosopher. That patient is sitting in front of you and the table separates the two of you. Already there is a distance between the two of you. And then you say, "Yes sir, how may I help you?" Yeah. The moment you say, "How may I help you?" you are professing, that's why we are a profession, your ability to help that patient. That patient is suffering, that patient is in pain, that patient is in fear, there is a gap between the two of you, that patient is completely helpless and you have full control over that patient. Yeah? That is the type of power, that is the type of situation you have in front of you just because you are a physician. And that patient will tell you every bit of every aspect of his life if you ask for it. His personal history, when he defecates, how often he has sex, who are his girlfriends, everything. Every aspect of history which even he will not tell a minister in the church. Yeah? So that is a complete type of power we have. That is a complete type of power which comes with a whole lot of responsibility. Yeah? And we talk about responsibility in a minute from now. I want you to look at this picture, yeah, and I'd like to make this talk a little bit interactive and ask you some questions, and you can put up your hands. Yeah, there are no rights and there are no wrongs. In these lectures, there are no rights and no wrongs. There are only opinions. It's critical thinking. How many of you feel that this picture shows compassion? Just show of hands. Okay. Compassion. How many of you feel that it shows caring? How many of you feel that it shows a worry or anxiety? How many of you feel that it shows somebody who is interested in making money? How many of you feel that there will be self-referral in this patient? How many of you feel that a lot of unwanted technology is being used? How many of you feel that this is clinical medicine at its best? This is how it was. It always was. A hand. The best technological tool we have is the hand. And the second best technological tool we have is the ability to speak and to be able to take care of patients. Yeah? This one picture shows to all of you what medicine is all about. Never forget this. This is what medicine is all about. Not about PET scans, not about 4D ultrasound, not about cardiac cath or angioplasty or stenting, not about laser-assisted surgery or robotic prostatectomy. That's all one part of it. This is basic medicine when the patient first comes to you and you profess your ability to say, "What may I do for you?" or "How can I help you?" Yeah? This is basic fundamental medicine. Even many of us in my generation were brought up on this one. This is a picture taken by a neurosurgery resident in KEM Hospital. He saw this. This is what we see. KEM Hospital is a gold mine of emotions. Yeah, you walk on the corridors, you will see gold mine of emotions. This is a child with tuberculous meningitis who has had a shunt done on him, and the mother who has not slept for several days. He called it a human shield of the mother over the child. She is getting her first night's sleep after a shunt surgery has been done for this child. Yeah? This picture may move you. You can just pass it by and say, "What is that? One more patient." It can become a statistic. But this picture tells a story of human suffering that you see day in and day out, and you have taken an oath to alleviate human suffering. Yeah, and we talk about oath a little later. So I did this internet survey of a batch of I don't know how many thousand or more people, and what most people said was that a good physician or a good doctor is one who is committed to patient care, good patient care, 77%. It goes on like this and treats the patient as a human being is 60%. Nobody said that they expect him to be competent. Yeah? Nobody said he should be competent because it's a given. They expect physicians to be able to be competent. So being caring is so important, and being ethical, being caring is so important, ethical is also important. And these are both physicians and lay people, and this is of course a blind survey. I was talking to you about the oath that you take, and I have this pleasure, or should I say, privilege of administering the oath to your last students here on this hall. I was administering the oath, and they were taking this oath by fire. They had a candle, hands on the fire, candle, and they were taking the Hippocratic oath. You guys can also do it in this same hall, standing in the aisles here, and somebody will be administering the oath, and you will say, I will do everything possible to take care of look after the well-being of my patient. And that afternoon, after the oath taking ceremony over lunch, somebody said, Ravi, you are glowing today. What's the problem with you? You are glowing and you look so happy. I said, I spent 14 years in G.S.MEDICAL college, every single day here, and this is the first time I have had this privilege of administering the oath. And to me, this oath is a big deal. That's what typifies what we are as physicians. Yeah? And when you take that oath, yeah, be proud that you have become a physician. From a Mr. or Mrs. or a Miss, you become a doctor, and that doctor in front of your name counts for a hell of a lot, because you then say, how can I help you? Yeah? The patient comes to you and you say, how can I help you? And this oath, every word of it is something that I would like you to stand by, if you will. Yeah, I cannot force you to do it, but the joy that you get of standing by that oath and taking care of sick patient is something you have to be blessed with. Shakespeare wrote this long back. The one way you can take care of patients is to be in the patient's shoes, to understand what it feels to be suffering. Yeah? That's called empathy. When you empathize with the patient, not sympathy, when you empathize with the patient, you know what it is to have paronychia, simple thing, paronychia, or to be in an ICU with your relatives outside, or to have a heart attack, the pain of heart attack. When you realize that, you are likely to empathize with the patient and be a much better physician. And there was this thing that you have to realize, that unlike when you go to a movie, when you go because you want to go to a movie, patients come to the hospital because they have to come, not because they want to come. They are becha in that sense, or lacha, if you will. And therefore, they are at your mercy. And having taken that oath, you are likely to be true to them if you follow that oath. Now, we talk about medical humanities, right? MH is medical humanities. It's not about telling you how to treat your patients, how to talk to your patients. It is something that cannot be taught. I cannot teach you in a lecture. It's something that you learn by the bedside from your own teachers, how they behave with the patients. And one thing you can learn by your own self is to realize it's not about communication skills, but being a member of the society in which the patient is. Yeah? That's what this is trying to say. And connect to another human being. Forget that he is a patient, like your friend, as a human being first. That you live in a society of which this patient is a part of, and you connect to each other as human beings. And to be able to do that, you have to understand yourself as a human being. What you think of yourself as a human being is so important, to be able to connect to a patient and his relatives and empathize as a human being. And first of all, you are born as a human being, and then you become a physician. So I often find it very surprising that when I ask somebody's name, what's your name? And they'll say, my name is Dr. Ramakant. Yeah? It's very funny, right? We are not Dr. Ramakant. An architect doesn't say, my name is architect so and so. An engineer doesn't say, I'm an engineer. Why do doctors have to say, I'm Dr. so and so? Yeah. So when I say I am Ravi Ramakantan, somebody will say, you mean you are Dr. Ravi Ramakantan? I say, my name is Ravi Ramakantan, I happen to be a doctor. Yeah, there's a subtle but important difference between the two. So this is what he is trying to do. You are first a human being and then a physician, and you understand yourself you understand the patient and the society in which you live in. When you prescribe medication, will this patient be able to afford that? Or the investigation or test that the patient has. So you have to attach yourself, you have to empathize with the patient as a human being first. And that's so important, to be able to care for the patient. So medical humanities is something that cannot be taught. It's not good morning, say this, stand like this, wear an apron, etc. No, that's not it. It's not something that has to come from you within. And the best way for it to come from within is to look at your teachers and how they behave with their patients. Yeah? I'm not saying all of them will be right, many of them will be right, but those are the habits that you imbibe as you go to the wards and train as a physician. And this is where the arts come in. Yeah? The arts, for example, poetry, yeah? Or theatre, or music, all of these can be used in inculcating the liberal arts and medical humanities, and this is what we are hoping to be able to do in 5 years of medical, to let you understand medical humanities in a fun way. Right? We can have theatre over here, we can have poetry sessions here, and that's what I did. Okay? I want you to read this. This is a poem that I wrote, yeah, and I'm very proud that I wrote it based on an incident, real life incident from Tata Hospital. I'll give you a couple of minutes to read this poem. This is slide 1 of the poem, and there is a slide 2 of this poem. Yeah, I want you to read this because there is going to be some fun after this poem is read. Okay? Tell me if I can move on to the next slide if you're finished with it. Yeah? So I expect you to say slide, next slide. Yeah? Any one of you.
Next slide.
Next slide?
Yes, sir.
Yeah, thank you. Okay. Okay. Can we have the lights? I'm not done. Okay. But I want lights here. Anyone here to switch on the lights? And I need a volunteer. I know a girl, medical student who's a girl, and maybe somebody who's a long sleeve shirt, white shirt. Can you come here, please? Any volunteer? Yeah. Please do come. Call somebody from outside, don't fuse off the whole M&T. Yeah. Can I have a girl come in here, Aarti Thapa here? Oh, great. Can you stand in front of her? So, you read the poetry? You want to read it again? Oh, brilliant. You want me to go back? Can you go back one slide on this? Oh, this is the one. This is the one. Yeah. You can read. Okay. First of all, let's give a round of applause for these two people. It takes a lot of courage to come in front of an audience like this, unknowing what is going to happen. You have no idea what is going to happen. I will shoot you. Yeah. So both of you have come. Thank you very much, both of you. Yeah. Can we have your names? Okay. You are. Okay. So, that's what you said, you guessed correctly. I want you to enact that one small part, yeah, where you call out to the doctor and the expression of the doctor of what happens later on. So, it is going to take you less than 30 seconds to enact that in your own imagination. There are no rights and there are no wrongs, yeah. So, you have read this poem, you have some feelings in you, right, or no feelings in you, it depends, yeah. And you may just pass it by and say, what is the big deal? You have some understanding of the poem or you have no understanding of the poem. That's also fine. Because when you read Daffodils by William Wordsworth in Standard 3 and when you read it now, it makes a big difference. Yeah. So I want you to start acting up any part of it you feel that's important and for you to respond the way you will respond. Yeah? Great. Let's start. You do whatever you want. The floor is yours.
Please wait. Aarti here. I'm your patient. Yeah, bed number 13. Ewing sarcoma, your new adjuvant chemotherapy patient. You're going to administer me chemotherapy now.
Okay, great. Thank you very much. So, can I ask you, what does this convey to you? Again, no rights and no wrongs. What does it convey to you?
Patient was able for a treatment. She had some doctor was just
Doctor did not remember.
Okay, so essentially, we are not, yeah, please have your seats. Thank you very much again. So, you may say it's not possible, yeah, it's not necessarily not possible to relate to a human being, to relate to a patient as a human being, but rather as a case. Whereas the patient's aspirations are different. And this is something that happened real life at the Tata hospital. And this was narrated to me by the surgeon who was involved in caring of the patient. He was feeling like a lump of shit. He said, this is how I handle the patient, yeah? And he was feeling very bad. And he was trying to narrate this to as many people as possible and getting their justification. And everybody said, it's okay, so you can't remember all patients, all that was happening, yeah? So, I want you to think about this. Think about this, that's all. And remember, there are no rights and wrongs. This is the 10th time I'm telling you this. There are no rights and there are wrongs, yeah? There is a subtle difference between thinking and reflecting. Thinking is thinking about a formula. A plus B whole square is how much? That's thinking. There is only one answer. Reflecting is when you think about something like this, you may not even understand the poetry. Yeah? But you can reflect on what its implications are. And that is what is essential. What is essential as far as medicine is concerned. Because it deals with human beings. Yeah? And there are no rights and there are no wrongs. So I did this type of poetry, can we have the lights down, sessions with a whole bunch of radiology residents, right? And over a period of several years, and some undergraduate medical students too. This one is the report of what poetry did. So for about 15-20 minutes, this is not mine for sure, what poetry did to them. Reading poetry like this, I would discuss a case of radiology case, for example, a patient with a hepatoma, a patient with a lymphoma, a patient with a cerebrovascular accident, his relative, etc., etc. Put an appropriate poem related to that, not written by me, but they're available on the internet, and ask the bachus how they felt after reading the poem in relation to the case. And these are some of their responses. It's very interesting that all of them were to some extent or the other affected by the poem relating to the case. Yeah, in some way they are thinking something differently about the patient after reading poetry. Similarly, we can have art. Yeah, draw what you see. Acting just now. If I were to ask you, has this acting of this role made a difference to how you felt about this? You may say yes or no, and I don't care what the answer is, right? But you have enough understanding of this, both of you perform beautifully here, about how it happened. So you can have the performing arts or the non-performing arts to shore up your understanding of human relationship as far as patients are concerned. Yeah? And that is what we are going to be trying to do here in medical humanities as to G.S.MEDICAL students. I've been here for a long time. I have great talent as far as non-medicine is also concerned, right? You see the rangoli that comes in, you see the PowerPoint presentations you make, you see the art competition, you see Avishkar, you see the acting on the stage. All of you are not only brilliant, but at least a substantial number of you have great skills on performing arts, and you have to participate in this the way you want it. You can tell us, do this. As far as medical humanities is concerned, there are no ins and outs. Everything is acceptable in creating a human relationship with the patient. Yeah. So this is William Osler. William Osler was a great Canadian physician, in fact a surgeon, and this is what he said. Right? Do not look at what disease a patient has, but who is the patient who has the disease. Yeah. This was way back, a century back. Yeah, we are interested in what disease the patient has. We just forget about who is the patient who has the disease. Here's a picture that I borrowed from Lopa Mehta, the grand old lady of KM Hospital here. Yeah, she took this picture with her cell phone camera because she was so deeply moved by this side. So I did a little bit of R&D on this, and this is what I found out. This is outside Ward 1 and Ward 2, between Ward 1 and Ward 2 on the ground floor. And then this older brother was looking after this younger child, and the mother was inside with another child in Ward 1, in those ICU beds. And they had no option. This is all their option. The father was not around, because if he had been around, he would have lost a day's job, and that is all that they lived on. So this one thing, first you have to notice it, and then you have to be aware of what it means as far as the family is concerned. So you can't keep the mother in the ward or the child in the ward for 1 day more than that is required just for your academic interest. You want to do some tests. You're not asking to spend more money than what is required, though you feel that it is justified. So being aware of such moving scenes, there's nothing short of moving in this. And somebody from America who saw this presentation, similar presentation, was so moved by them that it came on the cover page of a radiology journal. So, and this is another slide I want you to look at. Any of you have seen this in G.S. Medical College? You know where this is? And this is something like, what do you call that? What's that called? These people go around looking for places? Treasure hunt. This is a treasure hunt for you. It's there very prominently in G.S. Medical College and PM Hospital. Go looking around somewhere, and you will find this. It's so beautiful. Unfortunately, I don't know it from memory. I want you to look at this. Putting knowledge before wisdom, science before art, and cleverness before common sense. From treating patients as cases, and from making the cure of the disease more grievous than the endurance of the same. Good God, deliver us. How old is this? About a century back, Lopa? About a century back. So there is nothing that I have said today that is my original thinking. All of that has been said again and again and again and again by people. You just have to remember this and try to emulate in your own lifetime. My lifetime as far as medicine is concerned is almost over. I'm hoping that you guys will take this on to the extent that you can practice it, try and practice it, and become a better physician and a better caregiver. And this last few slides here, you cannot always cure. We are not gods, but there is nothing that prevents you from caring for a patient every single time. Caring is empathetic. A shoulder, a hand on the shoulder. Do not worry. We'll try to do the best we can. Talk to the relatives. Give time, give time, give time. Nothing prevents you from doing that except the lure for money. I know I'm preaching a little bit, but I'm just trying to convey something I feel that's extremely important. So with this last slide, the need for caring when you cannot cure, and the need for caring even when you can cure, I hope that you will start thinking. I don't want you to do anything. Just keep thinking on how you can integrate all of this in your daily practice of medicine as you learn clinical medicine on the bedside. There are numerous examples of how by the bedside clinics, medical humanities is integrated. In real life, it's integrated. I did it to an extent in radiology lessons by integrating poetry into that. It's possible. You have an idea, you can try. Your teachers may say, where is the time? I am very busy. This is not important from the point of view of exams. Life is not exams beyond 5 years, right? You are going to be a physician all your life. So I am giving you with this thought to ponder on this whole problem. And if you have any suggestions, give it to us. We don't have all the brains that we need to have. You are there. It's what you want that we will try and implement. However outlandish it may look, we are willing to try it out because we want to learn from you much more than you will learn from us. Thank you very much for your attention, and thank you for sitting here. Sorry? Pardon me?
I would request students to now actively participate from what they heard.
Okay, anything you want to say, it's always welcome. Always welcome. Some of your teachers will accept anything you say, some of them will not. Play it by the ear. Don't go and tell some opinion to a teacher who doesn't want to hear it. She becomes your examiner, you're finished. So, otherwise here in this house, in this room, anything will go. You can come and say, don't show your face again here. That's fine. Absolutely fine. That's feedback, right? So Lopa wants you to give any feedback that you want. Have the courage to give feedback. Have the courage. That's the only way. If I make some food and you eat it and you don't give me feedback on how lousy that sambar was, I'm not going to learn. Yeah? By now you know that I'm a Madrasi, I'm talking about sambar. That's how it is. Yeah. And always remember one thing. This is something very, very primitive. Yeah. When you speak in a hall, what is my first sentence? Am I audible at the back? Right? When you speak, make sure that everybody in the hall hears you, and there is no reason for you to necessarily speak in English. Yeah. All original thinking comes from your native tongue. All of you are learned through English, and sometimes you may not be able to express yourself in English. So any language is okay, reasonable language. It can be in Hindi, it can be in Marathi. The language you can pour your heart out. That's fine. Most of us understand these languages. Yeah, there is no shame in not being able to speak English fluently, not at all. And this is something I've learned very late in life. I used to be a running dog of English. Now I feel that it's completely wrong, because we are interested in communication, not in the language that which you communicate. Yeah. Thank you.
Sir, this is an observation. Prospectively, we students are being told such nice things, but what I have seen in the emergency areas, I mean, the residents there, they also need to, go through these kind of teachings, which they may
Is
not
somebody
have.
making a note? Just make a note, na? Somebody please.
So, I think
Quickly make a note. Yeah.
I think a slight,
Dr. Padmanja is making a note here.
a little bit of addition in their curriculum also should be implemented, so that changes can be seen much more quicker than we would produce. And
So top down.
yeah,
Top down. Yeah. Makes sense.
this is prospective. Like we
Yeah,
won't commit
absolutely.
those
Yeah.
mistakes.
You learn by role models, or
But we see that people are committing exact mistakes. So I think we should first treat them also,
I
the
agree.
residents,
Yeah.
then preventing the disease coming through us.
Yeah. Okay. Fine. Yes, please.
So why don't we have behavioral sciences?
One minute. Take the mic. No, it gets recorded also.
So why don't we have behavioral sciences in our academic syllabus? Why is it not given such a...
Yeah, because the NCI itself has to do that in a syllabus. So Dr.SUPE is trying to work with the NCI and the Maharashtra University to get something called outcome modules for faculty. Yeah, attitude and communication model. It will happen by and by. Medical humanities, as a word, as a phrase, has for the first time appeared in the MCI. I don't know what they call it, syllabus or whatever, in the last 2 or 3 years. Before, this whole thing was not there at all. So over time, this will change. You can work with our team. Dr. Padmanja is here. Talk to her. Through her, you can approach the team and see what can be done. Yeah. So things will happen. There is nothing like behavioral sciences that we want to talk about. Yeah. Something less complicated. Yeah. Which can work. As I said, treating another person as a human being and working with them and stuff like that. But you are right. Going away from the medicine, going to the art of medicine, you want to call that very grossly. Yeah? Yeah.
So I think this was a very, it really opened up our minds, and in a way, I think this can be integrated in the program that we're having, because I am interested in art history and I was taking this course online. And in that, they actually had the introduction directed towards professionals of medicine, towards lawyers, because something that is key to all these professions is observation, which is key to medicine, to artists, art, whatever, lawyers. Any profession needs observation at its base, and that we can learn through art as well. Looking at a painting is as much, it involves a lot of observation as well. So if we take art history in relation to medicine, because a lot of the artists, Da Vinci made a lot of medically oriented paintings, sketches, so we can have something that sort of correlates the two, and we can learn a few things from that. And apart from that, I feel that medicine is a very young science, and I feel that there are a lot of grey areas. Even as I'm learning, I feel like I can't keep up with what we are already, what we know, and then what is more to be known in the future. And as a result, there's a lot of, at least for me personally, I feel very underconfident in a way because there's so much to know and we don't really know everything. And then in front of a patient, you're supposed to be knowing. So how to deal with that aspect of medicine? That it is not it's not black and white. There's a lot of stuff that we don't know and how to respond in such situations. So if we can have something on that.
Okay. About the part about observation of art and observation as a physician, it's a brilliant point because it's now being described for a long time. And in medical humanities, art criticism, yeah, like I told you, is a very integral part of it. I think you made a brilliant observation.
So thank you so much for this wonderful lecture session. But I wanted to ask you, or I wanted to say this, that we know, every one of us knows, every one of us sitting here knows about this, the medical humanity part. But I am not seeing many faces of resident doctors here. And one of the resident doctors, I would like to say that it's not, actually, practically speaking, it's not possible to practice medical humanity in such a depth in our KM hospital or in any such hospitals, in GMC hospital or government hospital, because a resident doctor has not slept for 3-4 days in a go, and he goes to the ward. There are so many patients, 50-60 patients in a row, and he has to just complete the round before the senior resident comes or before the lecturer comes. And then there is no question of medical humanity there. Then there is no question that he hasn't ate, he hasn't slept for 3-4 days, and then how can he give someone humanity when he's not getting it? So I think if the doctors, if we resident doctors or if we doctors get it for us, then only we can pass it. So that's a genuine issue which I feel, or which I have seen in our setup. It's not possible for us, sir.
Yeah.
Really sorry.
Yeah, this is something which has come up as a repeated objection to all of this. I hope Dr. Padmaja will address it in some way if she feels like over a period of time. And there is validity in what you're saying, but some of that is naive, you know. It can be addressed, but it needs a lot of discussion and working on, and it should be said. It's the same.
It's possible. Whenever we pass out from here, the resident, I'm a community medicine resident, I get a lot of time for myself, and I can do my personal life, I can live my personal life. But the residents in medicine and surgery, they don't have anything. They can't do anything. They don't have time to eat also. So
yeah, your point has been noted. We will work on that. Dr. Padmaja is very active in this area. She is a gynecologist, and she knows how busy our residents are and how this can be implemented. Yeah. Okay. Thank you. Okay, then I won't make you wait any longer. It's been a long session now. Thank you everyone for participating. First of all, for coming here on this, what is that, traditional day? Yeah. Traditional day after photographs and selfies and all that. For one thing, if you have anything to say, more to say, you can email it, yeah, to Dr. Padmaja here, yeah, or to Dr. Lokometer, whoever you want to. What is the email ID we have for this thing?
Visit and this mine.
Sorry?
Rama.malik@gmail.com.
Okay, so you know Mrs. Rama Malik, she is the one who looks after the whole functioning of the department. You can meet her, take her ID from here, maybe you can write it down here if you feel like. Send your emails, yeah? Sometimes you can be anonymous in emails and you say whatever you want to say in emails, but we need your feedback. It's all about feedback. It cannot be one-sided, yeah? So, thank you very much.
Sir, I would like to say something. Then
Oh, sorry, yeah.
Hello, this is Dr.manu. What is my observation in the last 33 years I have been here. Now I think we will retire in few months, next month again rather. People now, the students especially, like, I want them to also go to the wards, see the patients themselves. You know, they do not go to the patients, they do not attend the clinics and all. So actually like that particular doctor-patient relationships, what they can understand from a clinic, through the clinic, that is I think little missing nowadays, because they have got this type of entrance exam they have to appear. They spend their more time in the libraries than in the wards. When we were students, actually we used to be all the time in the wards during our studentship, actually, like attending the cases, attending the clinics, attending the seeing the patient's problems and all, like then they will become more empathic, more sympathetic towards the patients. You can see now the lines there at the OPDs. The patients are waiting whole day, like like the queue is up to the gate there actually. They have taken leave. They cannot go to the work. Like how they are in the standing in the queue and like to get to the doctors and all. Even that is a problem, that one day leave, just attending a doctors for the patients also is very, very difficult. Even that also you should understand the patient's problems. If you are open, if you are with them, if you want to learn, I think it's the best way that you can go to the patients, the wards, see the patient, take history, learn about it, what is their problem also you can thereby understand. Also, attend the clinics, not only learn from your reading the books.
Yeah, this is another topic that there will be a lot of blame game going on. I've heard this again and again. Teachers say students don't come, students say teachers don't come. So this is something that can be subject to open debate. Yeah? Or meetings can be, something has to be discussed. Once there is openness of purpose, yeah, that you can decide which way forward. Yeah? So this is some of the things. Student-teacher relationship, I called it bachus, right? I never said students. Because when you're a student, we just teach. When you're a bachu, we take care of you. And there is a huge difference between students and bachus. So I always say bachus like you, and big bachus are PGs. So to me, it's a sacred relationship. One of the reasons I was in KM is because of this bachus. Yeah, it's such a fond relationship.
Yes.
It's very important. There can be open communication with bachus, especially bachus like you, who are like our father-student or son relationship. So we will gradually open up the doors of dialogue. Again, it comes to dialogue between students and teachers, where each understands the other and where the problem is. So you have a big responsibility on your heads of creating traditions in this institution, traditions which have never been there as far as open communication and dialogue is concerned. What the teacher says happens, or what the teacher student do wants that. Okay, so can we stop on Lopa? Yeah. Fatmaja, anything else you want to say? No, we'll conclude it been long enough, and I don't want to get bored. The last thing we want. Thank you very much.
I just want to say a very big thank you to Dr. Ravi, because it was a great pleasure to hear his we go running back.